Hi, this is Dr. Reade. I'm here today to outline and explain what you may expect during your functional medicine and nutritional appointments. First, your appointments are always individually tailored to the specific health issues you have, and also your particular biochemistry and your genetics. And many of you who seek treatments at our office have been suffering from chronic health issues and may require specialized or detailed diagnostic or lab testing to help detect the underlying causes of your chronic health issues. And chronic health issues often may require several months of care. On the other hand, for some of you that may have had more recent or immediate types of health issues, you usually don't require the same length of time, or you may not require the necessity of having more detailed diagnostic and or lab testing. Prior to your first visit, you will need to fill out ahead of time a detailed evaluation questionnaire that addresses your past medical history, your prior treatments, prior imaging and lab work, or any other medical procedures you may have had, and also listing your current and or chronic symptoms and complaints. We want to look at your diet, your dental history, a listing of all your prescription and or over-counter medications, any supplements you may be taking, and also a mental and emotional assessment, and several other things. And we will also encourage you to send us any lab or imaging findings to us ahead of time as well. And this information is vital in uncovering the root and causes of your health issues. It is also needed to help to determine what further testing may actually be required. Again, we do this to be able to identify what you need as an individual for your specific dietary, lifestyle adjustments, and supplements to help assist you in resolving your health issues. So you can watch this video on the Triad of Health to get a better idea of our approach to solving your health issues. I also want you to be aware that can be multiple factors coming to play that can affect your health, and it does take time to resolve these multiple factors. It does take time. We are also working in conjunction with the body's natural processes and not relying on a pharmaceutical intervention. It also does take time assessing and addressing the main factors causing your ill health, which are biochemical, physical and structural, and mental and emotional. And furthermore, the body will try to adapt and achieve harmony and balance, but it often does this at the risk of placing further stress on organ systems and or cellular function. So as a result, the body often must be healed in different steps, and the healing also involves multiple levels. It's almost as if you're trying to peel off the layers of an onion. Well, let's go over an example. For instance, we have a patient that comes in. They're complaining mostly of joint pain, muscle achiness, muscle stiffness, along with fatigue, depression, and weight gain. So we kind of ask, how did this patient develop all these symptoms? Well, here's what we found. This patient, first of all, has a very high stress job and a demanding lifestyle. They often do not get appropriate sleep, and they often find themselves eating on the run. And they gravitate towards eating a lot of convenience foods that are rich actually in carbohydrates, bad fats, and are pretty low in most of your good nutrients. We find that the lack of sleep, the high stress, the poor diet begins to affect the adrenal glands and the hormones that it secretes. This results in a blood sugar imbalance, along with fluctuations in some major hormones such as cortisol and insulin. And these continual fluctuations in insulin and cortisol can begin to affect and worsen the quality of sleep. It decreases energy levels. It'll alter dopamine and serotonin levels. And it will also lead to a decrease in the integrity and strength of a person's ligaments, discs, and joints. And when the cortisol and insulin imbalances become prolonged, it will cause a patient to become more insulin resistant. Now we find that with insulin resistance, this can lead to further weight gain. The additional weight also will put more additional strain on the different joints in the back or other lower extremities. The insulin resistance, along with the nutrient-poor diet, results in poor energy production at a cellular level. And then this patient will usually have no desire to exercise, and this can begin to decrease in total muscle mass and strength and more weight gain. And the loss of muscle strength can result in further problems with their joints. The increasing joint and muscle pain will cause a patient to reach for a quick remedy to alleviate their pain by resorting to non-steroidal anti-inflammatories, such as like ibuprofen. We find that using ibuprofen when used with some regularity will begin to cause problems with the stomach, digestive tract, and potentially the kidneys. Unbeknownst to most patients, the chronic usage of non-steroidal anti-inflammatories like ibuprofen actually accelerates joint cartilage degeneration. It also can result in improper digestion, resulting in poor absorption of iron, calcium, B vitamins, and many other nutrients. And the usage of these non-steroidal anti-inflammatories, along with a high carbohydrate diet, and the continued stress can alter the bacterial microbiome in your gut, which can result in damage to your small intestine, resulting in what they call a leaky gut. The leaky gut will then allow actually some of the different bacterial byproducts to pass through the lining of the small intestine, and it'll actually elicit an immune system response and inflammation. And this inflammation can actually spread throughout the entire body. But in this particular patient, most of the inflammation seemed to occur more at the joint level. And eventually, this chronic inflammation can lead to further, cartilage degeneration and increased joint and also muscle pain. So as you can see, this is almost like a slippery slope, and that many levels of involvement have occurred. And if you're interested in finding out a little bit more about leaky gut and or lipopolysaccharides or bacterial waste byproducts, you can go ahead and access our website and take a look at some of our different articles. So in this particular scenario with this patient, how would we go about treating them? Well, first off, we would go ahead and have the patient alter their diet. We'd go ahead and probably put them on an anti-inflammatory diet. We may have run a blood test on them to find out which foods they may be sensitive to, so we eliminate some of those things from their diet. And we'd have to make sure that they would try to get to sleep by 10 p.m. and make a proper routine of sleep. And we find interestingly that going to sleep by 10 o'clock, we find that usually is the most restorative time for the adrenal glands. We also might begin to have them do some mild stretches and some mild weightlifting. We'd also have to try to clean up and heal their leaky gut with probiotics and other products. We'd have them get off their prescription medication in conjunction with the approval of their medical doctor when the time came right. They may need a course of chiropractic treatment and physical therapy to go ahead and restore joint dysfunction, decrease neural irritation, and also help to restore normal joint and muscle function. They may need different supplements to help to decrease the joint inflammation and also help to supply proper nutrients so that their, basically their joints and their muscles can begin to repair and rejuvenate. So as you can see, there's a lot more involved instead of just taking medications for pain control or for inflammation. And again, have to remember that many of these medications don't really resolve the underlying reasons for the presenting, complaints and health issues. Well, I hope you enjoyed this video and you came away with a better appreciation of the human body and that treating the underlying causes is a great task. I hope you also came away with a greater appreciation of what is involved with treating somebody and using functional medicine. And I want to remind you, if you do the right things, that there is actually hope for a healthier, happier life. And we anticipate that we can be of help in your journey back to health. So if this seems to be what you're looking for, please contact my office at 480-732-0911, and one of my staff members will be happy to assist you. So once again, I want to thank you for watching our video.